New York City Council members are turning up the pressure on Congress to pass legislation to help care for those suffering from the aftermath of the 9/11 terror attack. Guajardo is outside City Hall with more on the story.
New York City Council members, advocates, and 9/11 heroes took to the steps of City Hall to call on the president and Congress to pass legislation to ensure funding to help care for first responders and survivors of 9/11.
It is totally outrageous that we have to be here to ask for funding of what should be promised to our first responders and to downtown residents.
As we get ready to mark 24 years since 9/11, New York City Council members pointed to a resolution they introduced back in August and called on the president and Congress to take action and pass the bipartisan 9/11 Responder and Survivor Health Funding Correction Act of 2025.
This funding is absolutely crucial. Whether it's post-traumatic stress disorder or cancer treatment, we need to make sure that funding is in place.
If passed, the bill would modify the World Trade Center Health Program by updating the formula used to determine the program's annual funding. Sponsors and advocates say the program is a crucial source of assistance for 120,000 responders and survivors of 9/11. They say current funding is not enough to keep up with the anticipated cost of the program's services.
This program is a lifeline. This program saves lives.
We say it every year, and it's never forget. We have to say it louder and louder every year, unfortunately.
On Tuesday, FDNY added 39 names to the World Trade Center Memorial Wall, members who died of illnesses related to their work in the rescue and recovery efforts at Ground Zero.
It's hypocrisy when you say never forget when people are sick and dying.
FDNY lost 343 firefighters on 9/11. Since then, more than 400 have died from 9/11 related illnesses. I'm Guajardo, CBS News, New York.
Tomorrow, as we mark 24 years since the attacks, we will have live coverage of the commemoration ceremony beginning at 8:25 a.m.